Today, we're going to talk about strategies to manage cognitive load, specifically on rounds. Today's talk will cover ACGME Clinician Educator Competencies, ETP1, ETP8, and ETP10. As a reminder, your working memory is a composite of your intrinsic, extraneous, and germane loads. And so when these are not in balance, your working memory is not optimized. So if we were to look at that in terms of an equation, the sum of those loads needs to be less than or equal to the working memory. So our goal is really to make space for germane load. And the only way to do that is to decrease intrinsic load and also decrease extraneous load. So we will talk about strategies on how to do that specifically on rounds. The article that is referenced multiple times in this talk talks about different strategies to decrease intrinsic load, and they're listed here. I want to specifically talk about isolating elements as a strategy. So let's pretend you're on rounds and you turn to the student and you want them to start presenting. One prompt you could give them is, give me the one-liner, but only include no more than 3 relevant pieces of past medical history. So this is really respecting that the working memory can only accommodate 7 different facts. And so maybe instead of saying hypertension, hyperlipidemia, CVA, TIA, CAD, and AFib, you can say someone with a severe cardiac history or cardiometabolic risk factors. Another example might be, let's say you're going to give a chalk talk on rounds, and you're going to decide to teach about hyponatremia, which is a very big subject. Well, maybe it makes more sense to isolate the elements, meaning you're going to save some parts of the talk for later. So maybe you're going to save the management of SIADH for another day. Now let's talk about some strategies to decrease extraneous load. So we're specifically going to talk about what a worked example looks like. And so when thinking about an example of a worked example, let's say that you're about to talk to a patient at the bedside. So you're outside of the room with your team, and you decide to tell them, I am going to demonstrate how to navigate this difficult conversation. Please focus on observing the interaction so we can discuss afterwards. So now you've already primed your team about what their job is in the room. And by modeling good behavior, they can identify points that they can then use on their own. And if you falter, it's also good to talk about your struggles there because we're all human and that's how we all learn. Finally, now that you've made space for germane load, you have to talk about how you can optimize it. So one way we can do that is something called self-explanation, as an example. So let's say you're on table rounds again, and you turn to the student, and you have a patient with pulmonary hypertension. Well, you might ask them, in simple terms, how might you explain pulmonary hypertension to a patient? So this requires them to be able to explain to themselves the pathophysiology of pulmonary hypertension and all of the effects and how the clinical symptoms can appear, how they can progress, and how treatment can or cannot help. And so when you do that, it allows them to increase their germane load because they are now actively engaged in that process. So to remind you, you want to make sure the sum of the intrinsic, extraneous, and germane loads are less than or equal to your working memory, which is usually about 7 discrete items. And our goal is to make space for germane load and then optimize it. And the way to do that is to decrease the intrinsic load and decrease the extraneous load. And that's it. Again, here is a reference to the phenomenal article that reviews cognitive load theory in medical education.